A potential crisis unfolding right before our eyes. It could impact you and your family. It is tonight's cover story. We're talking about rural health care, and it's something we've talked about a lot on this program because it's so important. Little by little, day by day, we have seen hospitals in rural areas across the country losing money, cutting programs, and in some cases, shutting down altogether. It means the result of all of that, millions of Americans now live in communities without essential medical services. We did some digging into all this, and we found more than 100 rural hospitals have closed over the past decade, and 600 more, over 30% of all rural hospitals in the country, are at risk of closing. As Kristen Crowley reports, financial losses and the lack of financial reserves to sustain operations are major contributors.
It may not look like much today, but just a few years ago, this was a hospital.
This was the actual hospital building?
Yes, the entrance of the hospital was over there, and we were probably closest to the nurses' station.
Horton Community Hospital was built in 1964 in this rural Kansas town of about 1,500 people. Today, it's this open field.
Rural hospitals in general, how important do you think they are to communities?
They're very, very important just from every aspect, between the jobs, the economy, the health and safety of the community members.
Mayor Brian Sturton says corporate mismanagement caused months of financial trouble, and the hospital ultimately closed its doors and filed for bankruptcy in 2019.
We lost health care, which was very important for our senior citizens, everybody in general, and then it dominoed from just health care to then our ambulance service.
That's the old hospital.
Mary Oswald has lived in Horton her entire life and remembers the excitement in town when the Critical Access Hospital first opened.
This one's me.
And this is in the hospital?
She was a registered nurse there for decades.
A lot of us bought supplies out of our own pocket, printer paper, Kleenex, toilet paper, just to keep it going.
Man.
You can only do that so long.
Horton now has a health clinic in town, but it doesn't provide critical care. For that, the closest hospital is 13 miles away, and Oswald's son travels even farther for the care he needs.
His doctors are in Topeka, which is an hour away.
And she says the closure has affected much more than just health care.
Well, it's kind of like a trickle-down effect. It affects business downtown, affects schools, it affects the whole community.
According to the American Hospital Association, rural hospitals support 1 in every 12 rural jobs and contribute about $220 billion in economic activity per year. When they close, it can be medically and economically devastating.
Rural hospitals in so many communities are truly a lifeline to the people that they serve.
And that lifeline for many has been cut. A recent analysis by the University of North Carolina at Chapel Hill shows that more than 150 rural hospitals in the country have either closed or converted to emergency or outpatient care since 2010.
They are very challenged in terms of making a bottom line to be able to sustain themselves. The math just doesn't add up.
According to research in the Journal of Hospital Medicine, rural hospital closures put surrounding hospitals at risk too by increasing their costs and patient load.
Who should be accountable in reversing this trend?
I think we all need to be accountable. I mean, certainly government as a major payer of healthcare services.
In December 2022, Congress preserved critical funding and extended programs for rural hospitals that were set to expire that year. And in January 2023, the federal government implemented a new payment and operating model, the Rural Emergency Hospital Designation. It offers an increase in Medicare reimbursement and a monthly facility payment.
We're going through a transition in rural healthcare where we need to provide that access point. Sometimes it may not be the type of hospital that we've seen in the past where they provide all sorts of services.
To qualify, the facility must have fewer than 50 beds and provide emergency rooms, clinics, and outpatient care. But not everyone is on board, including Harold Miller, president and CEO of the Center for Healthcare Quality and Payment Reform. In part because, to be eligible, hospitals are required to eliminate inpatient care, meaning patients can stay on average no longer than 24 hours.
Why one has to eliminate a service in order to get more assistance really doesn't make any sense.
Back in Horton, the community hasn't lost its desire for a hospital.
There's so much a small hospital offers that a large hospital don't. You know the people, and that makes them at ease because they know you.
These are paramedics.
Mayor Sturton says the town tried to regain a critical access hospital license, but efforts were unsuccessful because the nearest hospital cannot be within 35 miles. Even so, he says they aren't giving up on their small town.
Even some sort of urgent care facility would be nice, but rural America is pretty strong. We know how to make things work.
Kristen Crowley reporting for us. According to the Center for Healthcare Quality and Payment Reform, federal assistance helped sustain rural hospitals during the pandemic. But now, as that funding has ended and facilities face higher costs and difficulty attracting staff, they're feeling the squeeze more than ever.